Hello everyone and welcome back. Today we are doing a mock test consisting of 5 questions and answers in preparation for your general surgery examinations. Question number 1. A previously healthy 39-year-old man comes to see you for evaluation of a 7-week history of intermittent burning epigastric pain. During this period, he also felt bloated and uncomfortable, especially after meals. He reports no loss of weight or change in bowel habits. He has no personal or family history of serious illness. He takes no medications. He doesn't smoke and drinks 1 to 3 beers per week. Vitals are within normal parameters. On abdominal examination, there was mild epigastric tenderness on palpation without guarding or rebound tenderness. Bowel sounds are normal. The remainder of the examination shows no abnormalities. What is the most appropriate next step in management of this patient? The correct answer would be testing for H. pylori. This is the most appropriate next step in patients below 60 years old presenting with dyspepsia without signs of gastroesophageal reflux disease, no recent history of NSAID use, and no red flags suggestive of gastric malignancy or a complicated PUD. Testing using urea breath test is the most appropriate initial step of this patient's management. Once the diagnosis is confirmed, patients are treated with a triple therapy of antibiotics and a proton pump inhibitor. H. pylori stool antigen test is an alternative to urea breath test to detect active H. pylori infection. Both of these tests are rapid, non-invasive, and highly sensitive as well as specific. Question number 2. A 46-year-old woman comes in to see you because of a 4-month history of irritability and frequent bowel movements. She reports a 7-kilogram loss of weight during this time without a change in appetite or diet. She takes no medications. Her temperature is 37.4 degrees Celsius, pulse is 112 beats per minute, respirations are 16 breaths per minute, and a blood pressure of 126/74. On examination, her palms were moist. Thyroid gland is diffusely enlarged with no palpable nodules. Serum studies show a TSH concentration of 0.2 microunits per milliliter, a T4 concentration of 22 micrograms per deciliter, and it was positive for antibodies against TSH receptors. What treatment modality is associated with the lowest rate of recurrence for this patient's condition? The correct answer is radioactive iodine ablation. Among the treatment options available for Graves' disease, radioactive iodine ablation has the lowest recurrence rate. Hyperfunctioning tissue takes up the radioactive iodine and is then ablated. In a patient with Graves' disease, the entire thyroid would be hyperfunctioning. Thus, the procedure will ablate the whole gland and permanently cure hyperthyroidism. Question number 3. A 58-year-old man comes in to see you because of a 3-month history of bloating and nausea after eating. He has also had episodic abdominal pain during this period. He has osteoarthritis of the left knee. The family history is insignificant. He has a smoking history of 1 pack of cigarettes daily for 21 years. He drinks 2 to 3 beers daily. The only medication he is currently taking is ibuprofen. He is allergic to amoxicillin and latex. Vital signs are within normal parameters. The abdomen is soft, with mild tenderness on palpation over the epigastrium. The rest of the physical examination yields no further abnormalities. An endoscopy is performed and shows 3 shallow ulcers in the gastrium. Biopsy shows chronic inflammation with H. pylori. He is then prescribed a 2-week course of antibiotics and a PPI. What is the most appropriate recommendation for this patient at this time? The correct answer is avoid drinking alcohol. A combination of metronidazole and alcohol can cause a disulfiram-like reaction. Alcohol may also exacerbate the patient's ongoing inflammation. Question number 4. A 43-year-old woman comes to see you because of a 2-week history of an itchy rash on her left nipple. The rash started off as small vesicles on the nipple, which then spread to the areola. It is now a painful ulcer with a watery yellow discharge that is occasionally tinged with blood. Her medical history is significant for asthma that is being treated with theophylline and inhaled salbutamol. Her sister was diagnosed with endometrial cancer last year. On further examination of the lesion, it is a weeping ulceration that now involves the entire left nipple areolar complex. On breast examination, there are no masses, dimpling, or axillary lymphadenopathy. The remainder of the examination reveals no abnormalities. What is the most likely diagnosis? The correct answer is Paget's disease of the breast. This is a ductal carcinoma that infiltrates the nipple areolar complex, resulting in a red, scaly, or vesicular rash that is accompanied by pruritus, burning, and/or nipple retraction. The rash eventually ulcerates and causes blood-tinged nipple discharge. Question number 5. A 19-day-old baby has difficulty feeding and diarrhea for the past 3 days. He has vomited after each feed. He was born premature at 28 weeks gestation and weighed 1,100 grams. His feeds consist of breast milk and cow milk-based formula. He appears lethargic. His temperature is 36.5 degrees Celsius, a pulse of 120 beats per minute, respiratory rate of 67 breaths per minute, blood pressure of 70/35, and on examination, there is diffuse abdominal tenderness with rigidity and guarding. Bowel sounds are absent. Stool tested positive for occult blood. His HB is 12.6 grams per deciliter, white cell count of 18,000 per cubic millimeter, and a platelet count of 78,000 per cubic millimeter. What is the most likely diagnosis? The correct answer is necrotizing enterocolitis. NEC is the most common cause of an acute abdomen in premature infants with a low birth weight. Typically occurs 2 to 4 weeks after birth once oral feeds have begun. Infants typically present with poor feeding, lethargy, vomiting, diarrhea, hematochezia, thrombocytopenia, and/or distended abdomen with decreased bowel sounds. Typical X-ray findings include pneumatosis intestinalis, which confirms the diagnosis of NEC, and dilated bowel, portal venous gas, or abdominal free air if the bowel is perforated. And that brings us to the end of today's mock test. Thank you for listening. Please leave your thoughts in the comment section below. And if you find this content to be helpful, please give me a thumbs up and consider subscribing for more.